Turning now to other news, the Office of People with Developmental Disabilities Commissioner Courtney Burke just marked 6 months on the job. It has been a challenging time, to say the least. The agency has been under fire following a series of reports about patient abuse in state-run and state-supervised facilities. Burke has begun implementing reforms aimed at improving patient safety and also the agency's performance. She is joining me now to explain some of these changes. Welcome.
Thank you.
It really has been a long time. It feels like 6 months has been a very long time, actually. You have a new report out that basically, or you're about to release a new report that assesses where you were, where you've come to this point, and
Correct.
where you're going to be going. It seems that the reforms at this are actually beginning to take effect and work.
Yes, we're happy to report some improvements. We've done a range of things since I entered office to address health and safety issues. That's really been our first priority, as we realized that there were some deficiencies in the system that were resulting in negative situations for the individuals we're serving. So we took a number of steps, everything from increasing the hiring standards for who we're bringing in to work in our system, making sure people have proper training once they're in the system, shoring up how we're looking at incidents. If there's a negative incident for an individual that we're serving, how do we then make sure that the individual is safe, that we remove the employee that may have committed a negative act against them? And then making sure our investigations are shored up, so we have qualified, certified investigators investigating any negative incidents in our system, and working with law enforcement to make sure that the proper actions are taken if they need to be taken.
Do you think it doesn't seem to me to be too far off to suggest that you've professionalized the folks who work for you?
Yes.
Is that right?
It's very important work that people are doing who are direct support professionals. They're supporting individuals every day. They're doing meaningful things in these people's lives, and they really need to have the qualifications to make sure that we're doing a good job serving the people.
So some of this, I know you weren't here, you were here not too terribly long ago, and we talked about this, but some of this now is standard requirements, a drug test, a psychological assessment, a background check. I mean, all of these things are now standard. You will not be working for the agency unless you have these things.
Exactly.
What are other people who are already there grandfathered in? Can you, because you have union requirements,
right.
you can't force these folks to have these this standardization.
Right. We can't grandfather people in, but everybody coming into the system going forward has to meet the new qualifications.
And the other thing that I thought was remarkable is that it wasn't too terribly long ago that the governor and yourself announced this new policy that you would have a cooperation with the state police when it came to reports of alleged abuse, sexual abuse, and criminal abuse. Since then, you've had a marked increase in reporting. Do you believe that that's because there are more incidents, or just that people are now feeling comfortable in reporting them?
Well, the increase was actually in the incidents that were reported to law enforcement. So previously, we weren't reporting incidents as we should have been to law enforcement, and that's where we saw the jump. So it was a big and definite improvement.
But it doesn't necessarily mean that those particular incidents will come to fruition in terms of people will be punished any quicker necessarily, but they would be removed from the facility?
Right. As soon as we have any indication that an individual might not be in a safe situation and we have to remove an employee, we remove that employee right away. And we now have, because we've been automating the processes, we now have the ability to tell right away, once something is substantiated, an allegation is substantiated, to remove that employee and suspend them without pay. And that really sends a strong message back to people at the front line that we're taking quick action and that there are consequences if someone abuses someone.
So it almost seems that there are almost two parts of this. One is at the end of the kind of service that you provide, and the other is at the end of the kind of service that people want, that they access, right? So that your hope is to get the people who you are providing services to more involved in making decisions about what kind of services they actually received, instead of being dictated to about what they need to have.
Right. Well, one of the things we want to do longer term is to create a little bit more flexibility in our system so that individuals with developmental disabilities and their families have a little bit more choice about the services that they're accessing. Right now we have a set menu of services that we provide, and sure, it can be a good menu, but it may be more or less than what people need. And what we want to have is a system where they really have a broader menu of services and they have more flexibility in choosing those services.
So how do you accomplish that?
Well, we have to work with the federal government because a lot of people in our system, the services they receive are paid for by Medicaid. And Medicaid is a program that's funded by both the federal government and state government. So if we want to change that program at all, we have to talk to the federal government about letting us have more flexibility. So what we've done is we've applied to the federal government for what's called a Medicaid 1115 waiver. And it's a research and demonstration waiver. So it allows you to demonstrate new ways of delivering care and researching how well they work. And if they work well, hopefully the federal government will give us permission to do it system-wide so that everybody has the same access to new and innovative services and more flexibility in the services they're getting.
Right, and also part of the reforms that Governor Cuomo has instituted going forward is that a movement of more people into managed care, which is also something that you guys are trying to accomplish.
Right. We see it as, we call it care coordination, better care coordination, so that it shouldn't matter what service system you're eligible for, whether it's the Office for People with Developmental Disabilities, whether it's the Office of Mental Health, whether it's educational services. What really matters are the services that you need. And right now, those agencies are often siloed. And in a care coordination model where you have a global payment system, it's no longer driven by the system you're eligible for. It's driven by the needs that you have, and you can better coordinate among those agencies.
But doesn't, on the flip side, also that enable agencies to have a better handle on cost containment? I mean, isn't that also, from a sort of financial bean counting perspective, and not, yes, it might improve the quality of care that people receive, but also it's going to cut down costs for the state. Medicaid's a huge cost to the state.
Right. Well, potentially that is one thing that could happen, but I don't think the two concepts of getting good outcomes and reducing costs are mutually exclusive. I think you can have both. And in fact, a lot of people in our system are getting services that are very costly right now, and a lot of them only need maybe support services or respite services, and I think allowing them more choice will in fact lower costs in the system because it'll better meet their needs, and therefore it may be less expensive than what we currently have.
Do you imagine that going forward there are people in the system who will be receiving fewer services than they are now?
We want everybody to receive exactly the services that they need. We're trying to change the dynamic of a very supply-oriented system where we supply a bunch of services, but it may or may not be exactly what people need. We want it to be more of a demand system where there's an assessment done of what people's needs are, and then the services are matched to that demand. And
I sort of misspoke. There's a third component also to this report and to the changes that you're trying to bring to the agency. And you say on the cover of this that it's collective mindfulness,
yes,
which sounds something like the Dalai Lama might say. But actually, it's more of an attitude adjustment, really, that you're trying to bring to the agency, right? And it's a little esoteric. So it seems hard to change you're trying to change the culture of the whole place.
Yes.
Right? So how do you determine over 6 months or a year or whatever that that's actually been accomplished?
Well, we have begun a process of measuring the attitudes and opinions of people who work in the system to see if this will make a difference over time. And just to explain a little bit about what collective mindfulness is, if you think about the airline industry, for instance, or nuclear power plant industry, if you don't pay attention to any of the shortcomings and how things are running day to day, or you pass over something that is potentially very important for the safety of the system, it could have severe consequences.
Right.
And it's the same way in our system. If people aren't paying attention, if they aren't mindful of things that need to be attended to for the individuals we're serving, it could result in something as tragic as a death. And that's what we're trying to be mindful of, is to make everybody aware that safety is paramount, that if they see a deficiency, they should report it. If they see abuse, they should speak out, they should report it. And that's what we're trying to get to.
But by the same token, that they should be mindful of the fact that if, in fact, they are in some way engaged in those practices, there will be consequences, and that has not, in fact, been the case in the past.
Right, and we've changed all of that. We've looked at how our disciplinary practices work so that we can hold people accountable.
Also, I want, going forward, it's almost budget season, and everyone has been asked to do more with less. Will you be asking for more going forward from the governor?
Well, it's the governor has been very good about making the agencies really do a better job with less money, because right now the state budget has been really tight, as everybody knows, and demanding more, making the agencies show that they're performing well, and we are trying to do the same as well, doing a better job with the resources that we have.
So you don't imagine that you would be seeking to have more, because you are trying to change a lot of things and implement new programs, and that's not free, obviously.
Right. Right. Well, and that's part of our goal eventually, if we should get some of this flexibility that we want with the waiver. We think that there will be natural savings where people will just be better matched with what they need, and that will create savings in the system.
And unfortunately, we're almost out of time. I just want to ask, it seems that PEF obviously is coming up for this second vote. You guys were going to get hit very hard if, in fact, there are 3,500 layoffs. Is that correct?
In total, yes, there's 3,500 PEF workers that they're looking at. Initially, when the PEF contract was not ratified by the membership, we were looking at layoffs in the area over 300 people.
Right.
So, we're hopeful that this time around we can be optimistic that things will pass.
Well, Commissioner, obviously, we're looking for the formal release of this report in the coming days. Is
Yes.
that correct? Mm-hmm. And I'm sure that we'll have more on it. In the meantime, I want to thank you very much for giving us a bit of a sneak preview. Thanks for being here.
Thank you.